I want you to think about the last time your body surprised you in a good way. Not the kind of surprise you plan for or force, the kind that just happens, effortless, natural, the kind that reminds you that you are still in there, still capable, still fully alive. Now tell me honestly, how long has it been since you felt that? Because if it has been a while, what I am about to share with you in the next few minutes could be the most important thing you hear all year. Not because it is complicated, not because it requires a prescription or a clinic visit, but because it involves something sitting in your kitchen right now, something you have probably been using the wrong way your entire life. I am a urologist who has worked with hundreds of men over the age of 50, helped them restore their circulation, reclaim their confidence, and feel physically powerful again, in ways they genuinely thought were behind them. And today I want to talk to you about olive oil, because olive oil is one of the greatest vascular foods on the planet. But here is the thing almost no one tells you. Used alone, it cannot finish the job. There is one missing ingredient that transforms it from good to extraordinary, and most men have never heard of this combination. That ingredient is vinegar, and by the time this video ends, you will understand exactly why, exactly how, and exactly when to use them together for results you can feel. Drop your age in the comments right now. I read every single one, and I want to know where you are starting from. Let us start with what is actually happening inside your body, because this matters more than any recipe. After 50, your vascular system begins a quiet, gradual shift that most men do not notice until the consequences have already been building for years. The inner lining of your blood vessels, a thin and extraordinarily sensitive layer called the endothelium, starts losing its ability to produce nitric oxide at the rate it once did. And nitric oxide is everything. It is the signaling molecule that tells your arterial walls to relax, to expand, to open wide and let blood move with force and volume to every part of your body that depends on it. When nitric oxide declines, your arteries tighten, blood moves more slowly. The tissue that depends on rapid, robust blood flow begins to feel the deficit. Your energy drops, your stamina fades. And for millions of men over 50, the most intimate physical responses they once counted on become unpredictable, then unreliable, then quietly absent. Here is the fact that changes how you understand all of this. The arteries inside the penile tissue are the smallest arteries in the entire male body, smaller even than the coronary arteries feeding your heart. That means when blood flow begins to decline anywhere in your system, the erectile tissue is the first place to feel it. Research from the Journal of Sexual Medicine has shown that just a 5% reduction in arterial blood flow can produce up to a 50% loss in erectile firmness and ejaculatory force. 5% reduction, 50% loss in function. That is not a small margin. That is the difference between confidence and avoidance, between closeness and silence. And this is where so many men make the same well-intentioned mistake. They switch to olive oil. They follow the Mediterranean diet their doctor recommended. They eat better, move more, do everything right, and they feel somewhat better in general terms, but do not understand why the specific intimate changes they were hoping for never fully arrive. The reason is this. Olive oil is a protector and a carrier. It is rich in monounsaturated fats that support endothelial health. It delivers polyphenols, powerful antioxidants that reduce oxidative stress in your arterial walls. It reduces systemic inflammation. It is genuinely one of the most vascular supportive foods you can eat. But olive oil cannot trigger vasodilation on its own. It cannot send the activation signal that tells your arteries to release, to open wide, and to let blood surge through with the force that firm erections and strong ejaculation require. For that signal to fire, your body needs nitric oxide stimulation from the inside, and olive oil, no matter how premium or pure, does not stimulate nitric oxide production on its own. You have the protection, you have the foundation, you are missing the spark, and that is exactly what vinegar provides. Stay with me here because this is the part that changes everything. Inside vinegar is a compound called acetic acid. When acetic acid enters your bloodstream, it activates an enzyme in your endothelial cells called endothelial nitric oxide synthase, or ENOS. This enzyme is the factory that produces nitric oxide. Acetic acid tells that factory to turn on, to ramp up production, and to flood your arterial walls with the signaling molecule they need to relax and expand. When your arterial walls relax, the diameter of your blood vessels increases. Blood that was moving slowly now moves with force and volume. In the penile tissue specifically, that surge of blood fills the two spongy chambers called the corpora cavernosa. The veins that would normally drain blood away get compressed by the swelling tissue, trapping the blood inside. The result is firmness, sustained firmness, the kind that comes from proper circulation rather than will or effort. This is the same fundamental pathway that pharmaceutical medications for erectile dysfunction use. The difference is that acetic acid activates it naturally, without dependency, without side effects, and without a prescription. And here is where it gets even more powerful. When you combine vinegar with olive oil, you are not just adding two healthy ingredients, you are creating a biological partnership that neither ingredient can form alone. The polyphenols in extra virgin olive oil protect the nitric oxide that acetic acid triggers from being destroyed by free radicals before it can reach the smooth muscle tissue in your arterial walls. The monounsaturated fats in olive oil improve the absorption and bioavailability of acetic acid through your digestive system. And the anti-inflammatory compounds in olive oil keep your endothelium soft and responsive, so that when nitric oxide arrives, the arterial walls can actually answer its signal. Think of it this way. Vinegar is the key. Olive oil makes sure the lock is in perfect working order. Together they open the door that neither could open alone. To recap what we know so far, olive oil protects and supports. Vinegar activates and stimulates. Together they create a complete circulatory event that men over 50 cannot achieve with either ingredient in isolation. And we are just getting started, because there are 4 specific mechanisms at work here, and each one matters for a different reason. Mechanism 1. Nitric oxide activation and sustained vasodilation. We have covered the core of this. Acetic acid triggers enos. Enos produces nitric oxide. Nitric oxide relaxes smooth muscle in your arterial walls, blood vessels dilate, and circulation surges to peripheral tissue, including the erectile and prostatic regions responsible for firmness and ejaculatory force. Olive oil protects that nitric oxide from oxidative breakdown, extending the window during which it can do its work. This mechanism alone is responsible for the most immediate and noticeable effects men report. Warmth returning to extremities, responsiveness coming back online, the body answering in ways it had stopped answering. Mechanism 2. Blood sugar stabilization and endothelial protection. Every time your blood sugar spikes after a meal, particularly after refined carbohydrates, your body releases a cascade of inflammatory compounds that directly damage the endothelium, the very layer of cells producing your nitric oxide. Over years and decades, these repeated spikes stiffen and scar the arterial walls, making them progressively less capable of vasodilation. Acetic acid taken before meals blunts those blood sugar spikes dramatically. Studies have consistently shown that vinegar consumed before a carbohydrate-rich meal reduces the post-meal blood sugar rise by 20 to 35%. That is 20 to 35% less inflammatory assault on your arterial walls with every meal. Compounded over weeks and months, this is not a subtle effect. It is vascular restoration from the inside out. Mechanism 3. Visceral fat reduction and testosterone preservation. Visceral fat. The deep abdominal fat surrounding your organs is one of the most aggressive suppressors of testosterone in the aging male body. It actively converts testosterone into estrogen through a process called aromatization. And it produces inflammatory cytokines that damage blood vessels and further suppress hormonal function. Acetic acid has been shown in multiple studies to reduce visceral fat accumulation, specifically in the abdominal region, more effectively than general caloric restriction alone. Less visceral fat means less testosterone suppression, less vascular inflammation, and a hormonal environment that supports both libido and ejaculatory function more fully. Mechanism 4. Microbiome balance and systemic inflammation reduction. Your gut microbiome, The vast community of bacteria living in your digestive system controls the baseline level of systemic inflammation throughout your entire body. When your microbiome is imbalanced, inflammatory signals circulate constantly, constricting blood vessels, degrading nitric oxide, and creating the chronically tight, low-flow vascular environment that drives erectile dysfunction and reduced ejaculatory force in men over 50. The acetic acid in vinegar, particularly apple cider vinegar with the mother, feeds beneficial bacterial populations and helps restore microbiome balance. When inflammation drops at the systemic level, blood vessels relax. When vessels relax, circulation improves. And when circulation improves, men start reporting changes that go beyond the bedroom. Warmer hands and feet, clearer thinking, better energy in the afternoon, deeper sleep, a general sense of physical vitality that had been quietly draining away for years. 4 mechanisms, all working simultaneously, all supporting the same outcome, and none of them fully accessible from olive oil or vinegar used alone. Now let us get to the part that actually matters. How do you do this? What do you use? And when do you take it? The pre-meal ritual is the foundation of this entire protocol. 10 to 15 minutes before your 2 main meals each day, typically lunch and dinner, mix 1 to 2 teaspoons of apple cider vinegar with the mother or red wine vinegar into 8 to 12 ounces of room temperature water. Sip it slowly over 5 to 10 minutes. Do not drink it quickly, and never drink vinegar undiluted, always in water. The timing matters enormously. Taking it before the meal means acetic acid is already activating your eNOS enzyme and beginning to blunt your blood sugar response before the inflammatory cascade from your food has a chance to begin. You are not reacting to damage, you are preventing it. The daily combination meal is where you bring the 2 ingredients together with the greatest synergistic effect. Once per day, ideally with dinner, build a meal around extra virgin olive oil and vinegar used together. 2 tablespoons of cold-pressed extra virgin olive oil, 1 to 2 teaspoons of your chosen vinegar, a generous base of dark leafy greens such as spinach, arugula, or mixed greens, and real whole food additions like tomatoes, red onion, avocado, and bell pepper. These are not decoration. They carry L-arginine, the amino acid precursor to nitric oxide, along with additional antioxidants that extend and amplify the circulatory effects of the core combination. Whisk the oil and vinegar together with a pinch of sea salt and fresh herbs. Eat it slowly. When these ingredients enter your bloodstream together, the synergy is active and complete. What to expect and when to expect it. This is a biological process, not a pharmaceutical intervention. It works with your body's chemistry, not around it. In the first week, the changes you notice will not be sexual. They will be systemic. You will likely wake up feeling more clear-headed. Your hands and feet may feel warmer. Afternoon energy may stabilize in ways you have not experienced in a long time. These are signs that circulation is improving throughout your entire system, and they matter because they confirm the mechanisms are working. Between weeks 2 and 4, many men begin noticing the return of morning erections. Arousal feels more natural. The physical response feels less forced and more spontaneous. Confidence begins to rebuild quietly, without fanfare, in the way real confidence always does. Between weeks 4 and 12, the improvements become reliable and sustained. Ejaculatory force improves as prostatic circulation is restored. Intimacy becomes something to anticipate rather than manage. The distance that had grown begins to close. Individual results vary based on age, baseline vascular health, consistency, and overall lifestyle. But the men who commit to this protocol daily, without skipping, without expecting overnight results, almost always come back to me with the same words: I feel like myself again. Before you go to your kitchen, I need to give you a few critical points because your safety matters more than any result. Never apply vinegar directly to your skin or to genital tissue. The acidity causes chemical burns, scarring, and nerve damage that I have treated in clinical practice with outcomes that were genuinely painful and long-lasting. This protocol works internally, through your bloodstream. There is no topical shortcut, and there never will be. If you take blood thinners, diabetes medication, or have a history of acid reflux, kidney disease, or serious cardiovascular conditions, speak with your physician before beginning. Vinegar lowers blood sugar and has mild blood thinning properties, both of which can interact with medications. Never exceed 2 teaspoons of vinegar per dose. Always dilute in water. More is not better, it is simply harder on your stomach and your esophagus. Now, one of the men I worked with was 64 years old, a retired contractor from Nashville. He had used olive oil for 3 years after his cardiologist recommended the Mediterranean diet. He felt healthier in general, but told me with quiet frustration that nothing had changed where it mattered most. We added the vinegar protocol exactly as I have described it today. 5 weeks later, he came back and said, "I did not say anything to my wife at first because I wanted to be sure it was real. Now I am sure." That sentence told me everything I needed to know. Here is what I want you to do tonight. Go to your kitchen, get your apple cider vinegar and your extra virgin olive oil. Before dinner, mix 1 teaspoon of vinegar into a glass of water and sip it while you prepare your meal. With dinner, make the simplest version of the combination: olive oil, vinegar, greens, and whatever whole foods you have available. Write down how you feel tonight, your energy, your clarity, your sense of yourself. Do it again tomorrow, and the day after that. Give your body 30 days of consistency. Track what changes. Trust the chemistry, because your body is not finished. It has simply been missing one ingredient, and that ingredient has been in your kitchen the entire time. If this gave you something today, share it with someone who needs to hear it. Subscribe to this channel for research-backed guidance on male vitality every week. And leave your age and your biggest question in the comments below. I will be reading every one. I will see you in the next video.